good day, ma'am. Rather than J. Manera, your student nurse from Level 2, Section 2, and today I will be talking about the immunization of the pediatric patients. And prior to have this is to have blindfold. Now, when we say immunization, so these are the components to produce the antibodies that will help you to attack developing virus or pathogens that will invade inside your body that can cause disease. So we have two types here, the natural and then the acquired. So when we say natural, these are antibodies that is produced by our own body, and the artificial or the acquired is the antibodies that is given to an individual. So in acquired, we have two types here, the active and the passive. So active, we also have two classifications here, the natural and then the artificial. So when we say natural, these are genetic and inherent, or namamana siya. So it is from our um parents, and then the artificials, these are the vaccines that is given to us after having that infection. And then the passive is, we also have types, the natural and then the artificial. So the natural, we can get it through breastfeeding and transplacental, and then the artificial is through the post environmental exposure to the infection itself, or if you are susceptible and you have a person that is having this infection, then you'll get this that particular disease, or you will get this artificial immunity. So we have the Philippine immunization schedules of 2007. So starting at birth. So in at birth is we have the happy baby mnemonic, so Hepa B and then the BCG. Now after that is the child will go after 2 months, or the child, if the child is 2 months, is we have the Hepa B, the DTaP, rotavirus, and then the IPB or OPB, and then the PCB. Now 4 months is also like that, DTaP, uh, also like that, but there is no Hepa B. So DTaP, rotavirus, um, IPB or OPB, HIB or Hib virus, and then the PCB. Now 6 months is there is an additional vaccine, which is the flu vaccine. So we have the 12 months or 1 year old is the Harry Potter murdered Voldemort. So H is for Hib, P is for PCV, M is MMR, and then V is for Voldemort. So after that, if the child is now 4 years old, he or she will get the four vaccine. So we have mnemonics here. The my doctor is very forgetful. So M is for MMR, D is for DTaP, V is for the varicella vaccine. And then the exemption here is if the child is having a fever or if there is a pregnant, you will not get this um, vaccines. So we have the live attenuated vaccines, so BCG, influenza or intranasal, and then the MMR, OPB, and then the and then the varicella. Now we need to have a newborn screening of about 24 to 48 hours, and if you have an accurate or inaccurate results, you need to have a follow-up checkups after 2 weeks. And then, why do we need to have a newborn screening? It is because we need to determine if there is a metabolic disorder at an early age. Now, we have five components here, the G6PD. When we say G6PD, there is too much production of glucose that can cause death. And then the next one is the galactosemia, or there is an increased production of the um, sugar. So our management for here is the lower the sugar, of course, and then the congenital hypothyroidism, which can cause mental hyperthyroid, which can cause mental retardation, Now we have the congenital adrenal hyperplasia, and then the phenylketonuria. And then we have our law here, and the which is called as the RA 7600. So we the title of it is the breastfeeding and receiving uh sorry, Breastfeeding and Rooming in Law Act of 1992. So ideally, you need to have, or we need to breast a pregnant woman need to breastfeed her child 6 months. So after that is you can have the formula or 2 years old, and then the worst case scenario is 2 weeks. And here is the mother has the right to breastfeed, and you the mother has the right or the child has the right to be being breastfeed. And that's it for the immunization and the breastfeed and rooming in law act of 1992. Thank you po.